Hey YouTube, it's Marita from the Nurse Lounge and welcome to my channel. I want to say thank you so much for all the new subscribers who have come to my channel and subscribed, wanting to know more about nursing, specifically nursing, because this is primarily a nursing channel, and everything about nursing and everything about me, and who have watched my videos and commented and asked very, very good questions about nursing. And I really thank you for coming to my channel. This video specifically is about what makes a good clinical instructor and what good faculty basically look like. So if you want to know more about what makes faculty or clinical instructors good versus not, all right, so let's jump right in. You notice I have on my nurse-ish shirt today. I love this shirt. I am a registered nurse, everyone. So if you are new to this channel who don't know me, I'm a registered nurse, 15 years. OBGYN, well baby nursery is my specialty. I am a nurse educator as well. I do clinicals with nursing students. I'm in the classroom as well. I am in school myself to pursue my doctoral degree in nursing, in executive leadership, and I will graduate in May of 2020. So I come to you as a source as an expert source, shall I say, not someone who's just basically rattling off my opinions about things. I do have opinions about things, and in those videos I will let you know what my opinion is. If it's an opinion, I will state that, shall I say. I will state that this is my opinion. But for the most part, everything I come to you with is based off of evidence-based practice, which is how we as nurses should govern our practice and our day-to-day activities and care for our patients, based on evidence-based practice and not based off of opinions, what the other nurse told you to do. It has to be, that's how we govern our practice. So anyway, today's video is basically on what makes a clinical instructor great, what makes faculty, your didactic faculty, which sometimes is the same as your clinical faculty, great. Now, for a lot of you who are in nursing school, and let's say I went to nursing school 15 plus, what, 17, 18 years ago at this point. So my views of what was good then and my views what is good now are totally different, because guess what? I'm on the other side now, and I know what it takes to make a great nurse. Some of these programs, and if you are part of one of these programs that does this, I'm sorry, but what makes a great faculty or clinical instructor is highly relatable to the dynamics of the nursing program that you're in. So me, for instance, I teach at several different institutions currently, and I get to see how they practice and do things at the institution, what is allowed there, what's not allowed there. And I can tell you that some institutions govern themselves in a way in which they don't tolerate any bullshit, okay? And that's just to put it bluntly. And I'm not really one to be vulgar on here, but I am one to say it exactly how it is. They don't put up with any bullshit. And the ones who don't put up with any bullshit put out the best nurses. That means they have a certain standard and criteria that is required for their students to be successful, that they know that they will go and pass those boards, and they know they will represent them well in the nursing profession when they walk out there and represent that school well. There's other schools that I've taught at, they tolerate bullshit. So when they tolerate bullshit from the students, they tolerate bullshit from the faculty, you get people who are not really teaching to their potential or their ability. You get shitty nursing students coming out. Students are reflective of the education that they receive from the educators that they had, period. That's all it is. That's short, sweet, and to the point. I wish I could end the video there, but we're gonna go ahead and carry on. So what makes a good clinical instructor? We'll start there because I focus mainly in clinical, okay? So let's start there. What makes a good clinical instructor? What do you all think? Is it someone who lets y'all get out of clinical early? Is that who makes a good clinical instructor? Someone who lets y'all go on coffee breaks and stuff like that all day? Someone who is not actually on the floor with you? Now, to that point right there, not on the floor with you, that depends on the nursing program, because there's some programs where the faculty are spread amongst different floors, so they can't stay on the floor with you. They have to kind of rotate through and check on everyone. I'm not talking about them. I'm not talking about them. I'm talking about the ones who go sit in a lounge somewhere, go sit in the cafeteria while you up on the floor doing whatever you're doing. That's the ones I'm talking about. So if I'm stepping on some toes, I'm stepping on some toes, okay? It is what it is. So let me tell you what I do. I am with my students majority of the time. I check on my students majority of the, or all the time, actually, not majority of the time. What I do is this. A good clinical instructor is someone who is present. He or she is present. You will always know where your clinical instructor is. If I have to use the bathroom, I'll tell a student or two, one that I can find, hey, I'm about to run to the bathroom real quick. I will be back. My students always, at least one or two of them, will always know where I'm at. Period. They know where I'm at. I don't escape, okay? A good instructor has experience in that clinical area. Have y'all ever had a clinical instructor who they got placed in OB clinical, which is what I do, by the way, but they're really a mental health nurse, but they needed a body? Do you really think you're going to get a good clinical experience out of that? No, you're not. Because he or she is not well versed, because that's not their area of expertise. So could they do a head-to-toe assessment? Oh, I can do a head-to-toe assessment on anybody because I'm a nurse. And fundamentally, you're a nurse generalist. So when you come out of school, you're considered to be a nurse generalist, which means you have a little bit exposure to various areas of nursing. So yeah, I can go somewhere and do a head-to-toe assessment on anybody. But would I be quick to pick up on that something's not right? Not necessarily. I myself may say, you know what? I can feel that something's not right, but I can't tell you what it is. And then, by the time I figure it out, it may be too late. They could be dead. That's kind of the point. You need someone who's going to teach you what you need to know about that area, and it should be their area of expertise. Also, a good clinical instructor has recent clinical experience themselves, meaning they're still practicing. I know some instructors who teach clinical who they have not practiced since the 1980s. I've been a nurse. I was actually born in 78. So if this person I'm talking about hasn't practiced since the 80s, what can they show you in 2019? They're out of practice. That's not how this works. When she teaches clinical, she's teaching them, she has nothing to show them. She has nothing to offer them. Why? Because she doesn't know herself. I personally still work PRN. Matter of fact, I gotta work Friday. I might do a video for y'all. I'll probably do a vlog that day. I still work. I still work in the hospital setting. I'm still learning things as we go. I'm still doing things. I'm still like, oh, since when we started doing this? In another video, I talked about how I got my first psychotic schizophrenic patient like a month ago. My first one in 15 years. How do you think I would know how to handle something like that if I've never experienced it before? How do you think I would know how to handle a postpartum hemorrhage if I haven't did it in 20 years? I'll wait. You don't. How many times, prime example, I'm PRN. Do you know how many times I forget my password? I have it written down. But do you think I can go into work every day and just log onto the computer? No, because I don't be remembering it, because I be off of work for 2 to 3 weeks at a time. I only work 3 days per 6 weeks because I'm in school. So if I'm working 3 days per 6 weeks, that means I'm going in about every 2 weeks or so. Sometimes I clump them up together, but for the most part, I would do every 2 weeks or so. And if I'm doing that, I can't even remember my password, let alone how to teach a student anything. You have to stay in practice to be relevant. The next thing you have to have is professionalism. If you are not professional as a faculty, you can't expect your students to be professional either. So if you are coming in here late, now we all are late from time to time. There's traffic, there's flat tires, life happens. I ain't talking about any of that. Some of the people who are chronically late to clinical. Clinical starts for us at 6:30 in the morning. I usually go to the floor first to see which patients I'm going to get before I see my students. You will hear an ambulance coming here soon. We'll let them pass. Oh, they just cut it off. Anyway, you will you know, so I tell my students that, so they don't think, well, she's just late every time I come. No, I say, this is what I'm going to do. I have very high regards for professionalism. If you are not professional, you will have a clinical unsat from me, okay? Because that's what you're being evaluated against. If you are being disrespectful to your peers, to the faculty, or to the staff, you will have a clinical unsat from me. 2 unsats, you're out the class. You're out the clinical. If you fail clinical, you're out the class, out the course. Yeah. So I have high expectations. I have very high expectations for my students. I do not allow them to sit on the countertops. Excuse me. I don't allow them to eat or drink at the nurse's station. They cannot chew gum when they're on the floor with me. You can chew gum while you're at lunch, but you cannot chew gum or eat candy on the floor because that's a JACO violation. Chewing gum is not a VACO. Chewing gum is not a JACO violation. I don't let them bring food or drinks to the floor. That is a JACO violation. The gum thing is just unprofessional because a lot of my students don't know how to chew gum appropriately. There's too many smacking and carrying on and popping their gum. We're not doing that. We're not going to represent the School of Nursing that way. So they're not allowed to have gum at all on the floor. They have to come prepared in the appropriate attire. If they come in with their hair down, our hair has to be put up at all times in some type of, you know, ponytail or whatever. It cannot be down as my hair is now. And even when I go to clinical myself, my hair is always put up. If you've seen other videos, even when I go to work, my hair is usually put up somehow. I really practice the way in which I want my students to practice. So I'm not one who does one thing and expects my students to do something else. Look, I don't have nails, okay? I do have nails, but I don't have false nails. In nursing school, we're taught what? Well, for us, we cannot have our nails showing above our hand. So if you can see my fingernails above my hand, that means they are too long. I do have fingernails, but they are not, I don't do acrylics. I don't do any of those things. Why? Because it's not allowed. My students can't have it, so neither can I. We're not allowed to have it. So I actually practice, I lead by example. Now, if I'm going to be off for, say, a month, sometimes I'll schedule myself to be off for a whole month, and I want to go get my nails done, there's nothing wrong with that because I'm off. But I don't come in there with artificial nails where, you know, they breed and harbor bacteria and cause risk for infection. You know that as nurses. You know, in nursing school, you can't have bright pink nail polish. At least at our school, no bright pink nail polish on. Makeup for women and nowadays men have to be modest. This pink lipstick I have on right now, it's a no. I can't do this on the floor. My makeup, otherwise, I'm pretty much more of a natural makeup kind of person. So my makeup, for the most part, is pretty natural. But this is a bold lip, okay? We don't have bold lips. The students can't have a bold lip. Now, once you become a nurse and you go to your facility, that's something different. But I'm talking about what nursing school, what makes you good for that. So, again, professionalism, how you're appropriately attired, you're dressed appropriately. I check for those things. Let's go to the, excuse me. I personally do not allow my students are senior level students, so they're about to graduate. My students do not shadow. I actually have them be the nurse with my supervision, meaning they take care of their own patients. They're not shadowing. I feel that at some point in your program, now you have to do what you have to do at your program. If that's what's required at your programs, you shadow, okay? But I feel like a good instructor, if allowed, will not allow you to shadow. Why? Because you need to be able to kind of decipher this for yourself. I'm not talking about junior level students. I'm talking about senior level students who are about to graduate. You should be able to decipher how to care for your patients, and you can't put the whole picture together unless you're doing the whole picture. Meaning that you should be assessing your patients. You should be able to do things by yourself. Some things by yourself. Some things the hospital or facility won't allow. Some things your school of nursing won't allow. At my school of nursing, in my facility, I'm allowed to be a little bit more autonomous with my students. So therefore, I send them on their way to do their head-to-toe assessments. I show them the first time. After that, I'm like, you go on your own. And I show them how to document things like that. I'm usually right outside the door where my students are. So like if they've never done something before, they feel uncomfortable, I'm there with them. When we pass narcotics, I have to pass narcotics with them even if it's a pill. If we're doing IV anything, I have to do IV stuff with them because it is IV, you know, and anything with IV access, I'm going to do. But if my student, if I have a saline lock, let's just say a patient has a saline lock, and the only thing my student has to do is go flush it, Guess what? I'm like, go flush it by yourself. Clean the hub. Push your 10 mLs of normal saline in. Clamp it back. Well, unclamp it, clean it, unclamp it, push it, clamp it back. If it flushed, you're good to go. They love the fact that I give them autonomy, if I can. Again, that's something that makes a pretty good instructor. Okay, let's go to the clinical, to the didactic side. A lot of these things still reign true on the didactic side as well. You want a nursing instructor, faculty who is well versed in the subject matter in which they teach. That's what you want. You don't want someone who's going to give you easy questions on your test. Why? Because the NCLEX is not easy. Nursing is not easy. You are there to save lives, not to be killing folks. And I guarantee you, what you see on the NCLEX, it's just where your state of nursing is saying this is what makes you minimally safe. Minimally safe. Not maximally safe. Minimally safe. So therefore, a lot of nursing requires critical thinking skills. And if they're not teaching you how to have critical thinking skills, if they're not teaching you how to have civility, teaching you how to be independent, if they're not teaching you how to be, I can't think of what I want to say, self-directed, they're not doing you any services. Nursing faculty should not be your friend. You should not be on a first name basis with your nursing faculty. There should be a true standard of faculty student. And even though I look very, very young, so some people think they can call me by my first name or think that they can talk to me like at the side of their neck, I shut that down real quick. I'm not one to tolerate any of that. And you will get a clinical unsat from me, or if I have to write you up, you'll get wrote up, and then that goes against you in the program. My recommendation is to be humble. My recommendation is to go to school to learn. My recommendation is to ask questions. My recommendation is not to challenge your instructor if they're competent. I know a lot of incompetent instructors, so I know y'all gonna say, well, some of them not competent. I agree with you, because I actually teach with some of them. I'm kind of like, no, that's not how that works. I'm gonna leave it at that. That's not how that works. So if they're incompetent, don't call them out in class about their incompetency. Go to them in private. That's being professional. If you have an issue with your instructor, go to your instructor in private. That's being professional. If the issue is not resolved with your instructor, guess where you need to go? Chain of command. Go above them. Whoever above them is. That's what's being professional. If you want a good quality nursing education, you have to put something into it. You're not going to get anything easy out of nursing if you don't put anything into it. Nursing is not easy. I don't let my students, I actually don't do a lot of PowerPoint presentations unless it's like a difficult chapter. I expect you to come to class prepared to write, and you should have read your chapters already prior to class. And if you haven't read your chapters and you're lost, that is not my problem. You have a responsibility to read. Nursing school is not like taking English 101. Nursing school is a professional program, and it is designed, hear me out. Nursing school and other professional programs are designed to weed out the ones who do not belong in nursing. Do you want someone who makes straight D's and F's taking care of you or your child? Do you want someone who cannot critically think taking care of you, of your child or your family member? Do you want someone who can't practice discernment? Just because the doctor wrote the order don't mean it's right. You want someone who has a backbone. You want an instructor who has a backbone. I'm not one to be walked over, and I think a lot of people know that. I'm very much strong-willed, strong-minded. People know I'm not one to be walked over, and I'm okay with that. People will describe me as being very, well, let's just say this. The faint at heart don't deal well with me because they feel like I'm being too hard because of the fact that I have standards, and you will meet my standards. And when you meet my standards, you will be a successful nurse, and you'll be just fine. The ones who sit there and give you the easiest patients, the ones who do not ask you questions in clinical, the ones who don't grade your care plans the way they should be graded because they don't want you, they don't care if you're better because they're there for a check and they're not there for you. they're not doing you any services there. So even though, yes, you may pass with an A in your class, the true test is going to come when you have to go be with a patient like that. And don't think because of the fact that, well, this is not my area I'm going to be in, that you won't see that kind of patient ever again. I don't do mental health, but I see mental health patients all the time in OB. All the time. I've had patients who've had wound dehiscence where their incision has opened back up. And it's really become a med-surg issue, but they come back to postpartum because they have to bring their baby back with them because med-surg won't allow you to bring your baby because med-surg is considered to be a dirty area and we're a clean area. But my patient is dirty with an infection who should be on med-surg. So there's a lot of things that I don't really want to do or don't have to do in real life, or I didn't think I'd ever see again since nursing school. But guess what? I'm saying it because that's just the nature of nursing nowadays. So if you want to be successful, you want to know what a good instructor is, either didactic, the classroom side, or on the clinical side. It is someone who exhibits those attributes that I just named. In addition to that, he or she responds to their emails within 24 to 48 hours or whatever. Usually 24 hours is what the response is, with the exception of weekends and holidays. So if you send an email on a Friday, do not expect a response till Monday, because the weekend is not considered to be business hours or holidays. I expect I'm in school right now myself. So some of the criteria in which I am telling you is the same criteria I expect of my professors when I have issues with my classes. If it's something that I do not understand, I expect to be taught, because guess what? I'm frankly paying $3,000 per class to be taught. So I expect you, and you're getting paid for my $3,000 partially. So I expect to be taught what I need to be taught, but I'm going to be respectful about it. So I'm not telling you, if you feel like you're not getting a quality education, there's people to talk to about that. And you need to hold faculty accountable and clinical instructors accountable for that without being unprofessional or disrespectful. I consider myself to be a very professional nurse. I consider myself to be very thorough. If you see my videos long enough, I have 30 and 40-minute videos. Why? Because of the fact that I'm very thorough and I want you to know exactly what I do or what the subject matter happens to be. I'm not going to give you a 7-minute video for the sake of YouTube on something and you have no idea when you finish the video what the hell we're talking about. You know no more than you knew when we started. So again, you want clinical faculty and faculty that's in the classroom, a full-time professor or whatever, their associate professor, assistant professor, or whatever happens to be. You want them to be knowledgeable in the area in which they teach. You want them to have a certain level of respect for you as a student. You have to have a certain level of respect for them as your professor or as your instructor. They need to have, I'm kind of recapping here, they need to have expertise and recent experience in the clinical area. Things change so much in clinical, in the clinical component. They need to have recent experience. They need to stay with you on the floor if they can. If they can't, they can't. They need to challenge you. Nursing is about being challenged. So I challenge my students all the time. Do they hate it? Yes. I tell them all the time, when you're in my rotation, you will feel like you are up to here, like drowning, like the water is right here. I will never let your head go underneath water, but you will feel it right through here. But if you survive this, you'll be fine when you get to your next rotation. I will never let you drown, but I will let you feel it. I'm a facilitator. My job as a facilitator, as a nursing instructor, is to guide you to where you need to go. It's not to give you the answer. And that's what I have to tell my students all the time. My job is not to give you the answer. It's to guide you in the direction of the answer. You have to seek and find. And then I will let you know whether it's right or wrong, and then how we can correct it. That is what my job is as a facilitator, as an instructor. And I know my job well, and I do my job well. Again, you're not going to catch me doing a mental health rotation as a clinical instructor, because why? Even though I have a touch of mental health in OB, that is not my background. That's not my specialty area. So guess what? I should not be there. So some of these people are accepting these positions because they want money, or because the nursing program is so desperate they need a body in it, a nursing body in it. And they are not doing you any service when they do that. You may go to clinical and you may be paired with nurses who don't want to have anything to do with you as a nursing student. So you're not going to learn anything then either. So again, you need to have faculty in which they are invested in you. They are invested in your future as a nurse, because guess what? You represent their school of nursing. And I will not have anybody coming back reflecting on me saying, you know what, she was hard. What they will say is, I may not have liked her because she was hard and nobody else was. I'm pretty much known as the hardest instructor we have at one of the hardest ones we have at my school of nursing. And that's a compliment to me. And I don't mind that students are fearful when they come to my rotation. I don't really care about that, because at the end of the day, when they finish that rotation, they're going to come out as a better student. And as a reflection of that, they're going to come out to be a better nurse. And I've had so many students come back to me and say, I did not like you. I just did not like you. I thought you were too hard, this, and another. But I get it now. And again, that is a compliment. I take that as a compliment. I'm like, thank you. When they say, oh, you're so hard, I'm like, thank you. Because I would rather be the hard nurse who teaches you what you need to know than the easy nurse who gave you an A and you realize when you get to the next rotation or you get out there to be a nurse that you know absolutely nothing. You learn nothing in school. Which you don't know a lot, but you'll learn something. So anyway, hopefully you found this video valuable to you. I enjoy making these videos. So anything you want to know more about when it comes to nursing, put that comment below. If you look at my YouTube banners at the top, you will see 2 icons for IG. One is for my plus size journey. I love fashion, makeup, things like that. I am plus size. It is what it is. But the other one is for my melanin_RN_MPN page, which is my page that basically is the IG version of the YouTube, except for there's just pictures over there. And I have things to inspire and educate you over there as well. I have my doctoral journey over there, so I'm counting down the days to graduation, just like some of you are counting down the days of graduation. My title change will be to Dr. Marita in May of 2020. I'm looking forward to it, so I'm working very hard on that. I do have videos on my doctoral journey if you want to know more about that. I have not posted one recently because I really don't have a whole lot going on. I'm in my last year of school, or really 7 months of school, and I graduate soon. So I will have to do an updated video on that. If you want to see a video on a nursing school story, like how I survived nursing school, a nursing school story about something that went wrong and how I got my unsat, leave a thumbs up and I will do a video. Until the next time, you all take care. Bye-bye.